the brain is dedicated to sensation of the hands, the face, right? The feet, the neck, and the genitalia, guys. 2/3 of the brain is dedicated to receiving sensory information from hands, feet, face, neck, and genitalia. All right, and that's front and background playground. All right, so it's really important to understand that, hey, this is where a large amount of sensory information is coming in. Does everyone understand it? If my brain is dedicating 2/3 of its surface to these structures, then you better believe there's a large number of what? Surface structures that are relaying sensory information back to the brain. Does that make sense? If the brain is dedicating that much space, then you better have that many sensors on these periphery, at these peripheral structures. All right? Head, neck, hands, feet, and genitalia. Okay? Anybody else? Yeah? It's up here. Take a look at it. It basically shows you cranial nerve 1 through 12, their names, and kind of like where, actually, it doesn't tell you their names. It tells you where they're found. Then in the second one, it tells you where each cranial nerve will input into the structures of the brainstem. Then the third one talks about the two main, so here it is. The third one, this is important for everybody because this is a review sheet for you guys. The third one tells you exactly what spinal cord tracts I expect you to know. It's right there on the third one. And then the fourth one is telling you about the limbic system. Because we talked about the limbic system, that it's the primitive brain. And it's a whole bunch of diffuse brain structures that are involved there. So it talks about the limbic system, olfaction, memory, emotion and drives, and homeostatic functions like autonomic control and neuroendocrine control. That means hypothalamus and thalamus, pituitary gland have to be involved with the limbic system. Of course, so are the mammillary bodies, the hippocampal gyri, right? And these other structures, the diffuse structures in the brain. If you look up limbic system, you'll see that the notes that I've written here will kind of reinforce what the textbook has to say about it. All right? Are there any questions so far? Any questions at all? So this is up here. Please, I encourage you to come up and take a picture. The homunculus is my hand drawing. There's one of it in your textbook. And it shows you that homunculus it shows you the distribution of the sensory and the motor dedicated to the different areas of the body. And it is highly disproportionate. Why? Because let me see. All right? Remember that phrase when I was kids? You see with your eyes, not with your hands, right? But as children, almost everything that we see, we have to touch. And that's very important. So what we see, we touch. What we touch, we see. And what we touch and see, we learn about. We learn more about. We get more input from different textures you touch. You memorize. Does this make sense? This is why The Fuzzy Duckling is one of my favorite books. All right? If you guys never seen Fuzzy Duckling, then you need to go to the bookstore. Fuzzy Duckling.
I know the ugly duckling.
No, The Fuzzy Duckling. It's called The Fuzzy Duckling, and it's a book that has a whole shit ton of textures on it. All right? Yeah. So you have the little fuzzy duckling. He's this fuzzy little yellow duckling, and you touch it, it's nice and fuzzy. Right? Then the next one, you've got whatever, the slippery salamander or the sticky salamander frog, and you go to touch it, and it's like a sticky, rough surface. Guys, this is important because brain development in children, the more experience you give, the more connections you get. You got me? The more sensory experiences you give, the more connections you get. And the more you keep. Isn't that amazing? It is amazing, right? And so we learn through play. This is why it pisses me off to no end when I hear about how 3- and 4-year-olds are stuck in classrooms writing their names. Are you shitting me? That's not age appropriate. You do that at 4 or 5. 3-, 4-year-olds should be running around and flicking shit on each other. You got me? Tripping and falling and throwing stuff and being rambunctious. That is normal. Not kids sitting in a little desk with this little digital device, right? Flipping things with his finger. That is not normal, and I can assure you that our children's next generations are going to be some seriously effed up people, right? Because we don't even begin to understand what the new boob tube is going to do to them, right? That's what they used to call the TV. It literally has become the boob tube, right? Because now it's portable. So now you can be a boob all day, right? And just sit there and be like Beavis and Butthead. Right? Stupid cartoon. Super stupid cartoon. What? That's what these kids, there were some seriously stupid cartoons, man, right? And then it's like, that's what our generation of kids are going to be like, man. Right? Because they're not going to know how to what? How to run, how to jump. Guys, when you run and jump and you fall, you learn. You get back up. Yeah, it hurts. You cry. Yeah, it hurts. You remember the next time how to jump properly when you go to jump over that little stick or that little curb, right? And you boom, you fell, right? And your whole body just hit the curb, right? You'll learn next time, won't you? Yeah, you will. That's how we learn, through mistakes. So why are we always beating you guys up when you make mistakes? Or when you fail a class? Oh, you'll never get in with that class. You know what? I failed immunology my senior year at FIU. Did that prevent me from getting into medical school? No. Guys, it's not about failure. It's about what you do with those failures. It's about how you learn from your failures. Whether or not you're able to face your fears and face your failures and become stronger from it. That's what this is about. You understand? That's what this class is designed for. That's what my whole life has been about. And that's why I torture you the way I do. Right? Because I know what's out there once you leave here. They're going to torture you even more. All right? And there you're not going to have the chance of making a mistake. There it's life and death. Okay? So better to make the mistakes here. Okay? So that's the idea. Any questions so far? So we learn from our mistakes, and we learn through constant repetition. So that means if you really want to learn stuff, you got to what?
Practice.
You got to practice it. Michael Jordan didn't become top dog. He didn't become the most, famous basketball player of his era from sitting around talking about practicing, right? He practiced regularly. Allen Iverson, different story. Don't get me started with the whole practice thing again, right? He was just one of those special players that had every excuse in the world for not practicing, but then coming to games and shooting like 50 points, right? Get the hell out of here, Allen Iverson, right? I loved him. He was amazing. He always gave 110%. He just hated practice. He really did. He was bored at practice. This is why he had the whole spleen with practice. You guys look it up on ESPN. All right? But practice is how you become perfect. You're going to make mistakes. This is the reason why they don't throw you out there to the wolves and say, here you go. Go treat a patient like they do in medical school. First year med student, there you go. Go see a patient. Go figure out what's wrong with them. There you go. Go. You want to be a doctor. Go. See how difficult it really is. Right? And then you realize, I don't know shit, but then what? You got to learn how to what? Fake it. You got to learn how to fake it. You think I'm joking? Even when you don't know, you got to do your best effort to what? To fake it. Make it look like you know what you're talking about, right? In the hopes that you're going to figure out what the hell's going on and save that person's life before they figure out that you have no clue what's going on. You follow? Guys, this is reality. I'm not joking. This is for real. Because medicine is hard. You got 10 different patients come in, huh? 10 different patients with all the same symptoms. And you know what? They all got different diseases. What you going to do? What you going to do? It's silly. And they all got the same symptoms. But they all got different diseases. That's how hard this is. It is. So I want you guys to be aware of what you're getting into before you get into it. All right? I don't want you guys going halfway through and then realizing, this isn't for me. I want you to make that decision now. Is this for me or isn't this for me? Because this is the rest of your life. This is the beginning of the rest of your life. You're going to spend more time learning this stuff than you are with your significant others. All right? To the point where most of them are going to result in divorce. I hate to say it, but it's the truth. I hate to say it. You'll spend more time in the clinical setting with friends that you work with coworkers, than you will with your family. And if you don't have a significant other that understands that, then you're going to have problems at home. They're going to start getting upset because you're spending more time out than it just is what it is. So you got to be aware. You got to be aware of that situation. Today I was talking about the influence of estrogen and progesterone on the human brain. The reality is that women tend to use their brains more so than men do. Less lateralized, which means they use both hemispheres at the same time when they do any kind of task. Men tend to use only one side versus the other. So we tend to be more lateralized with our brains. Now, it doesn't mean that all men are the same or that all women are the same. Sure enough, testosterone and estrogen both play a role in the development of both male and female brains because we both produce both. The problem is how sensitive we are to these hormones. This is where sexual identity and gender identity develop. Everybody understand? So the gender, we know that are under control of these hormones, gender identity comes from what gender you have, right? So you identify yourself as male because you have male genitalia, or you identify yourself as female because you have female genitalia. But that doesn't necessarily mean that psychologically you feel male or female. Did everybody see the difference? Just because physically you're male or female doesn't necessarily mean that psychologically you feel male or female. That's a whole nother issue. And that has to do with hormone sensitivity and the amount of hormone and the amount of receptors. And so homosexuality is nothing more than the random chance event occurrence. You roll the dice. Oh, yeah, this one's going to be a heterosexual female. This one's going to be a homosexual female. This one's going to be a heterosexual male. This one's going to be a homosexual female. Homosexual male. So you got 2 boys, 2 girls. One of each straight, and the other ones are homosexual. There's nothing wrong with the kid. They're just sensitive to one hormone over the other. And so their identity will develop different from their gender, right? And so they're going to have to come to grips with that. And you're going to have to help them. Not hurt them, not make them feel guilty, not beat them up, support them. Because the world is going to beat them down, right? It is what it is. You can't stop it, and you sure as shit can't take the gay out of them, right? And I taught this for years, and it was interesting because last year, sure enough, NPR took a whole 3 weeks to explain this on NPR, which I thought was phenomenal because I was like, you know what? It's about time that they start talking about this stuff. And I can tell you, you will never meet a more homophobic person than Panis Padilla. As a kid, I was afraid of just completely fearful, because the church convinced me that people who were homosexuals were actually pedophiles. As an adult, I realized this big difference between homosexual and being pedophile. Like, wait a minute, my aunt is homosexual. She's not a pedophile. What the hell's going on here? Church man, are you brainwashing me again? Oh, no. You see why? You see why I take the stance I do on church and state? All right? Because the church will do some things to you, right? Make you think things that aren't really real. And then I knew people who were pedophiles who were not homosexual. Hold up. And they were part of the church? Oh, not cool, y'all. Not cool. You see what I'm saying? So I had, as an adult, I'd come to grips with that and had to reevaluate my thinking process and how I looked at people, you know? And basically, as a healthcare worker, and you realize, hey, you know what? I can't judge. So what if you like sticking things up your butt? All right, that's all good. Puts a smile on your face, it's all good. You better be used to it. You better be used to that little conversation, because you're going to have to ask the people, hey, do you stick stuff up your butt regularly? Do you enjoy that? Does that feel good for you? I mean, it's okay if it does, but just be aware, you're increasing your risk for this and that and the other. You follow? But you gotta be comfortable enough to have the conversation. If you don't have that conversation, then what? Then you're not helping them out, are you? You're hurting them. Because you're not educating them as to what risk they're gonna be, what they're at risk for because of the behavior, because you're afraid to speak up, because you're afraid to ask the question. Hey, do you have sex regularly? All this other stuff. These are all uncomfortable questions that you guys need to get used to asking. All right? And so, Professor Pete, when we talk about reproduction, we're talking about brain here, huh? What makes you think there's any difference between the two? Your brain mandates reproduction. This is, again, where we talked about this images that we constantly put up on TV and on boards, billboards, and on these websites, right? You think it doesn't have a role. You think it doesn't play a role. You think it doesn't make children more precocious. You're full of shit if you think that. Because all the images that we expose ourselves to change our brain chemistry at the instant. Somebody sees somebody else get their head blown off. That's a pretty disgusting image. Does everyone agree? How does that affect the psyche? It can devastate some people because they can't adapt. They're always going to see that image in their head. Right? How are you guys going to deal with it? Because you're going to see people come in with half of their head blown off, or half of their skull crushed in, or half of their rib cage crushed in, and you can't do shit for them. And you're going to watch them die in front of you, and you're going to have their blood on your hands, literally. What you going to do then? Yeah. Right?
My comment was going to be, what about ever becoming desensitized?
Yeah, you become desensitized. And that's where you got to be aware, I'm going to become desensitized, so I got to make sure I don't become what?
Inhuman.
Inhuman. Pathological. Huh.
Malpractice.
Well, no, but pathological, like nothing bugs you anymore. And there's a lot of people out there, man. You go to the ER, you'll meet a lot of ER physicians, nurses, EMTs. Yo, they're like Teflon, man. Nothing phases them anymore. They laugh at the stuff. That's disturbing. When you laugh at it and don't cringe. I've seen a lot of stuff, guys. I've seen body parts strewn over a field, right? Because I grew up when a high-speed rail, Amtrak rail, used to run through our town on an elevated. One time, a drunk guy who was on the rail got hit. We found body parts scattered. Another time, when my ex-girlfriend's their grandfather found out he had cancer and his wife had just passed. He went right up onto the train station. He walked right onto that train running 80 miles an hour, man. And 2 miles down the road, we found parts of his body scattered. 2 miles, almost 2 miles down. The train was going 80 miles an hour. Luckily, on one side, it was all like brush. And on the other side, it was brush, but with like old school rail cars and railroads and stuff. So the parts got scattered in places. And because we played as kids back there, we found some of those parts. And of course, we call the cops because it's a crime scene, right? It's a home, it's a suicide, but it's still a crime scene nonetheless until they collect up all the parts, put everything together, and then do what they do with the body remains, test it, make sure it's him, blah blah blah, this is the other. So you can only assume that it was him until you find the parts to prove that otherwise, right? That it wasn't him. You assume it wasn't him until you find the parts that confirms that it is him. So when you see this kind of stuff, right? I mean, it's tough. It's tough. And psychologically, man, so how does that translate? How do images translate? Well, everything that we see on our retina gets reflected back into the association cortex through this limbic system. Separately, a large amount of the occipital lobe is receiving almost everything that the retinas are receiving. And your eyeballs have retina on either one. And sure enough, your eyeballs are not running parallel to each other. They're running, intersecting. Intersecting. You guys remember the formula for the intersecting lines?
Y equals mx plus b.
So if y is equal to mx plus b, two intersecting lines would be what? Y is equal to 1 over mx plus b.
Are we doing math now?
Yeah, we're doing math. Right? So watch. Now watch. So if I have this, if I have this formula, 3x plus 2, right?
Right.
And then I have this one, it says y is equal to 1/3 x plus 2.
Right.
Well, the only difference is what? The slope was inverted under 1, yeah? Well, when I do that, sure enough, what? I create two intersecting lines. Well, sure enough, that's how the retina's set up. The two retina of the eyes are set up so that their lines of focus crisscross at a point in two intersecting lines. It doesn't work any other way, because if it did, then we'd get what? Double vision. I'd be one eye on you, one eye on you.
You wouldn't see.
You wouldn't be able to see. You'd see double. You wouldn't be able to see it. And if you can't see, then you can't balance. Does that make sense, guys? Because sight and sound are integrated on the back of the midbrain. And cerebellum gets that input as well, because cerebellum is responsible for balance and posture, along with what? Coordinating complex motor movements. Everybody follow? Yes.
What is it? Because at least when I was younger, it's not a concurrent issue, but I had a problem focusing. I had double vision. What does that mean?
Perfect example. Did you wear a patch?
No, I don't know what happened. I wore glasses for a little bit, and I guess my eyes.
You probably wore a patch at some point. You probably forgot. So what happens? When you get double vision, usually it's a muscle. Usually it's the lateral rectus of one eye. That's unopposed, meaning that it's pulling too strong, so that the medial rectus is weaker.
I just didn't know how to focus.
And so what winds up happening is because the one eye, because the lateral rectus is a little stronger than the medial rectus, then this eye will go this way. And this eye will still want to subtend towards this eye. So as this eye goes this way, it'll go this way. And what will happen is you're constantly trying to focus and refocus and focus and refocus. So what they do is they cover the good eye. Cover the good eye. And by covering the good eye, they force the bad eye to actually work towards this imaginary line that the other retina has proposed. And it pulls the weak muscle to work harder to get that eye back. And then sure enough, to take if they're lucky enough, they're able to get control, they take the eye patch off at some point, and the eyes are realigned to each other. So you can retrain the eye. You can do it through prescriptions as well, but the most effective way is usually the eye patch. Most people avoid the eye patch. When I was a kid, I remember the eye patch was fairly custom because glasses were expensive. And then there were some kids that I knew that had the glasses, and you could see it. They were wearing the glasses, and the one eye was still doing this. And I was doing this. And it was hard for them to focus, and you could tell. Can you imagine? You're supposed to be seeing one image in front of you, right? And instead you're seeing two images. You try to walk like that. You can't. You'd be bumping into shit. You follow? They have to converge, guys, at a point in front of your nose. You can't have each eyeball doing its own thing. It just doesn't happen that way. They have to converge. And that's why I mentioned intersecting lines in algebra. Because that rule has to be, whatever this line, axis of vision, that left eye has, the right eye better have the inverse slope of that equation to that line of axis, so that what? So that they get an intersecting point right in front of each other. Because that's the only way you're going to get the proper integration of sight with sound at the cerebellum, at the midbrain, which will then relay it to the cerebellum. It'll also relay it up to the cerebral hemispheres. Cerebral hemispheres are huge, right? So if we go back to this outline, right, where we talk about, forebrain and the cerebral hemispheres, right? Well, your cerebral hemispheres have a large amount of, they have cortex and they have medulla. And within the medulla, there's a large amount of white matter, tracks. And the cortex has 4 to 6 layers of gray matter. So this is heavy myelinated, not as myelinated. And then within that medulla, separate of the white matter tracts that are running up and down, you have these deep brain nuclei, they call them. These deep brain nuclei that are also known as motor nuclei. And those motor nuclei, they're called the caudate nucleus, the globus pallidus, and putamen. So these are the motor nuclei in the deep brain of the cerebral hemispheres. And so those are what? They're deep brain nuclei that are what? Motor nuclei. So when I go to initiate motor movements, I want to smooth out my motor movements. They smooth out. motor movements. Yeah? All these deep brain structures, they smooth out motor movements. So guys, if I have disease of this area, then what's my motor movements going to look like? Are they going to be smooth or rough? Sure enough, you can look it up. Parkinson's. And Huntington's. Huntington's actually has an actual dance. It's called Huntington's chorea. It's this rigid dyskinesia where the arms flare out of control. They don't have control. So it's not epilepsy where they have complete, flaring of the arms uncontrollably, right? And voracious is like really, you can tell the muscles are contracting. You can tell what's going on in epilepsy. In this case, it may look like epilepsy, but it's really not. It's what it is it's these deep brain nuclei, because there's three types. There's ACH releasing neurons, there's dopamine releasing neurons, and then there's norepinephrine releasing neurons. And you need all three of those properly to keep those structures working to smooth out. And if any one of them in that area gets affected, then you're going to have issues with these dyskinesias. So Parkinson's and Huntington's, they'll produce dyskinesias, which are abnormal movements or difficulty moving. Right? This means difficulty. Kinesia means movements. So difficult movements. So Huntington's and Parkinson's will cause difficulties in movement because of these nuclei that are in the cerebral hemispheres that are responsible for smoothing out motor movements. They're diseased, and they'll get. So here's one of them. One of them will be like this. They'll be at rest and they'll be shaky, and the other one will be normal at rest. But when they go to intend to grab something, they shake more and more. So when you go to intend to grab, you get more of a shake, versus you get a shake at rest. Now, here's the thing. In some cases, like so with the Parkinson's, you'll get the shake at rest. In Huntington's, you'll get the shake during intention. So you'll get what they call the intention tremor or the tremor at rest. But as the disease progresses, because it's the same area, then what? Then they all kind of get both. And you'll see it when it's really bad, when Parkinson's is really bad or Huntington's is really bad, they'll have the shake at rest and when they intend to do stuff. And this is when they can't function anymore. They have to, think about it, guys. We take shit for granted, don't we? Like, man, thank God I'm jacked up. My body's all kinds of jacked up, right? But thank God, I ain't got this. You know what I mean? Because this means basically, please put a bullet in my head. Because otherwise, I'm going to have to get some kind of surgery to figure out how to shut down these, or some kind of medicines that I'm going to have to take to try and shut down or smooth out what's not smooth. And that's just where they put what? Brain stimulators, like I have in my spine. They put it up in the brain to try and send impulses. They did this for epilepsy to try and reduce the epileptic seizures. Now they're doing it to try and smooth out the motor movements. It's called deep brain stimulation, guys. Who's one of the more famous people that has one of these diseases? Those of you who follow the 80s, Michael J. Fox. Famous actor, comedian, childhood star, became an adult. He was on Larry David. Anybody watch Larry David, HBO? He lived above him. And then he accused him of wearing his boots and then stomping on the floor above him. So Larry David got upset, tried to kick him out, and then it all backfired on. Larry David's always putting his foot in his mouth. You guys, you got to watch the show. It's hilarious. But anyway, dyskinesias, disorders in movement, guys. Okay, Parkinson's and Huntington's, play that role. How is this different from Alzheimer's? Oh, because Alzheimer's, guys, it affects the cortex. But remember, ALZ, Alzheimer's, affects the cortex. But remember, if it affects the cortex that's involved with memory, which is the parietal lobe, then you're going to be forgetting stuff. So Alzheimer's focuses on the cortex and the diseases of the neurons and the layers of the gray matter cortex. Whereas stuff like Huntington's and Parkinson's are looking at deep brain nuclei in the what? In the white matter. In the deep nuclei along with the white matter, there, that's different. It's a different area of the brain, guys. You see? Alzheimer's out in the cortex. All right? Parkinson's and Huntington's, deep brain nuclei. They're in the cortex, not in the medulla. Disease in the medulla. Remember we talked about this mad cow disease or Creutzfeldt-Jakob disease due to prion consumption of brain, right? Consumption of brain that's infected by prions, which is a protein. It's the only infectious protein known to man. It can convert the layers of your cortex, doesn't matter what area. So you could get some that would just demonstrate Alzheimer's type, right? And then that lack of mobility, because remember the prefrontal cortex is involved in what? Pre-planned motor movements. You see? So would you see a dyskinesia in somebody who has mad cow disease? Would you see it in a cow? Yeah. You don't see the cows with mad cow disease? They're not running around trying to eat people. They're just like zoned out, man. They're just like roaming. They're not even grazing. They're just roaming. That's all they're doing. They're just roaming. You just roam. They don't graze or nothing, they just roam. You see? And so what happens is it's the meal that they give the cows. When they kill the cows, they give that same meal back to the cow with the infected brain in it. That's what causes mad cow disease. Well, in adults, in humans, you consume this brain, prion, infectious protein kind of thing. It changes the structure of your brain structures, and then it makes you kind of like a zombie. You just kind of walk around, don't really eat, don't really do much of anything. So it's sort of like an Alzheimer's condition, right? Somebody who has Alzheimer's, they forget to eat. Yeah, they forget their name. Yeah, forget where they live. Yeah, right? Do they wind up having issues with walking? Because why? Because they can't pre-plan their motor movements. That's the frontal cortex. Oh, they have issues with memory? That's the parietal cortex. Guys, are you understanding me? Oh, they're losing the interpretive ability for sight, which is rare. Very rare is this. Right? Then it's affecting the occipital lobe. Because the occipital lobe is your primary visual cortex. And the association cortex, right? Because you got to have an association cortex for every primary. Did we do all the cortexes? And I showed you everything, right? On the surface. Okay? So now, once I go out of the forebrain, right? Remember that if we're talking about just forebrain here, there's another structure. There's the diencephalon. And remember that the diencephalon has three major structures to it, guys. The epithalamus, the thalamus, and the hypothalamus. Well, the hypothalamus, that's connected to the anterior pituitary, that's connected to the pituitary gland. Well, the pituitary gland sits in the sublutercicle of the sphenoid bone. The hypothalamus is huge. This is like major endocrine organ here. This is major endocrine organ. Major endocrine axis. Matter of fact, they call it the hypothalamic pituitary axis, the HPA. That's the beginning of next semester's endocrine. That's where it all begins, is at the hypothalamus, guys. You understand? And the hypothalamus, I already told you, is part of the limbic system, yes? And if you look at my notes, it says there that the hypothalamus is part of the limbic system, doesn't it? And the limbic system, we already said, is part of the primitive brain that all creatures on Earth have. Because all creatures have the need to what? Eat, sleep, reproduce, feel thirsty, right? Have an increase in heart rate, an increase in respiratory rate when they're in a fight or flight response, or rest and digest when they're relaxed. Everybody follow? Every creature on Earth has the same abilities, the same responses, at least every animal on Earth. Yes? The epithalamus is associated with the pineal gland. And the pineal gland secretes melatonin. And melatonin regulates the sleep cycle. Oh, and the sleep cycle is what? Stages 1 through 4 plus REM. And when you sleep, sleep is restorative. So this is where you repair the most. So if you don't sleep enough, then you don't repair the same. Did everybody hear me? So you need a certain amount of sleep to repair. You need a certain amount of sleep to rehearse. Even when you're asleep, you are awake and you're rehearsing everything that you've done within the day. You're rehearsing it over again. While you're sleeping. That's what they call rapid eye movement, guys. Okay? So now your thalamus, that's your main sensory relay center. That means all sensory information, I don't care where it's coming from, any one of the cranial nerves or any one of the spinal nerves, any sensory information that's coming back through the spinal cord, through spinal nerves to spinal cord and then up to the brain, it's going to stop right there, thalamus. All sensory information must go to the thalamus. All of it. Pain, temperature, crude touch, fine touch, proprioception, vibroception, stretch. All of it. Every single bit of sensory information from spinal nerves will run up through the spinal cord and go up to the thalamus. Any sensory information from cranial nerves will give off, depending on how high they are, they'll give off branches to the limbic system. They'll give branches off, but sure enough, thalamus. They're all going to go back to the thalamus. Smell, sight, sound, thalamus. Always. Will I have other places that they will go? Yes. Will I link sight and sound? Yes, in the midbrain. But will cranial nerve 2 and cranial nerve 8, will they give branches off that go to the thalamus? Yes, because all sensory information goes to the thalamus. You ready, guys? You got that? I don't care where it's coming from. All sensory information must be perceived by the thalamus. Why? Because the thalamus will hook up with the hypothalamus. And together they'll stimulate the limbic system. So don't tell me that images that we see on TV don't affect our psychological development. Okay? They do. And don't let anybody convince you otherwise, because you're going to hear a lot of people that lobby in Congress and all this other stuff for cable TV and all this other stuff, Netflix and all this. This is all adult stuff, right? And we're exposing our children to this. And we have to be conscientious that we are affecting their overall development when we expose them to mature, very mature images. All right? Children cannot distinguish between reality and fiction. All right? It takes them a long time to understand the difference. All right? So violent video games and all this other stuff needs to be X'd out. You understand? Now, don't get me wrong. I'm a huge video game junkie. You understand? I've been a video game junkie for years. But as a kid, violent video games didn't exist. I can tell you that violent video games do shape. These games where you pretend to be the pimp, right? Where you go around, you back slapping your hoes right on the street, right? Don't tell me that doesn't psychologically affect. That's bullshit. If you tell me that, you know what? I'm gonna be the pimp and take you out back and slap you like a hoe, right?
Did you play GTA 1?
Yeah, GTA 1, I played GTA 1. I was an adult when I played GTA 1 for the first time. That was really violent, dude. You got points for hitting people as they cross the street, right? Don't tell me that doesn't affect the psyche of children. It does. So don't be surprised when you have these kids grabbing guns thinking it's a game. They can go to the school and start shooting people like it's a duck shoot, right? You don't want. First of all, why the hell do we have guns that can shoot 44 rounds a second in the hands of regular citizens? You know what? I'm gonna violate your First Amendment right, You go ahead and try and buy that big ass M14 or M12 or M whatever you want to call it. I'm gonna prevent you from doing it because unless you're ex-military working for some kind of government, then you got no business buying a gun that big at all. Let alone the cartridges, let alone the bullets, right? That can go through armor. Like, what do you need armor-piercing bullets for, right? Are you hunting deer that robbed a bank? What is wrong with you? Seriously? Hey, man, don't get me started. Don't get me started. So, guys, all this plays a role, man. All of it. And we need to look at mental health differently, too. You know, this idea that, oh, yeah, you got mental health, something's wrong with you. Nah, guess what? A large number of us in this room have mental health issues. You just don't know it yet. Right? Your parents done fucked you all kinds of up.